Hello, welcome. I'm Mark Lagon, and I'm Chief Policy Officer of Friends of the Global Fight, which is an advocacy organization in the U.S. promoting the work of the Global Fund to fight AIDS, tuberculosis, and malaria. We work with partners on trying to end those three epidemics and all pandemics as they arise. It's a special pleasure to co-host this webinar with the J.C. Flowers Foundation and the Isdell Flowers Cross-Border Malaria Initiative in Africa. Our topic today is to look at how faith-based actors and philanthropists have been working in Africa to combat malaria and also to combat the rising problem of COVID-19, which has been disrupting the progress of partners in Africa to fight malaria. We're blessed today to be joined by Anglican and Muslim leaders who work together in Zambia, a Christian pediatrician in Namibia who works on malaria response, and two private sector leaders who've devoted themselves and their philanthropy to combating malaria, now complicated by COVID-19. The world's made huge progress against malaria. Last year, it distributed the 2 billionth bed net to prevent malaria infections. I work with the Global Fund. Since the Global Fund was founded in 2002, the malaria-related annual mortality rate has been reduced by 50%. Lots of progress. The Global Fund, for instance, as a multi-stakeholder partnership of states, the private sector, foundations, civil society, and faith communities, provides 65% of all international funding to combat malaria and has devoted over $13 billion since its founding for malaria control programs as of the middle of last year. But COVID-19 has been disrupting malaria services, the distribution of insecticide-treated bed nets, access to anti-malarial medicines harmed by COVID-19, and necessary lockdowns and measures to deal with it. The Global Fund took a survey, an irregular bi-weekly survey on November the 1st, and over half the countries that they work with have implementing partners reporting that they're experiencing disruptions still today in malaria service delivery, including 13% with high levels of disruption. The Global Fund's tried to step in with its COVID-19 response mechanism, helping 106 countries and distributing nearly $60 million to help countries fight COVID-19, deploy personal protective equipment, shore up health systems, and especially mitigate the impacts on AIDS, tuberculosis, and malaria programs. Before serving as moderator of the panel today, let me introduce one of those two private sector leaders who've worked together in malaria response, and he will in turn introduce all of our other panelists. J. Christopher Flowers is chairman and chief executive officer of J.C. Flowers and Company. It's an investment company that was founded in 1998 and specializes in financial services and manages assets in excess of $8 billion. He previously served as one of the founders and for some time the partner in charge of the Goldman Sachs Financial Institutions Group. Among his philanthropic engagements are launching and supporting Nets for Life, co-founding the Isdell Flowers Cross-Border Malaria Initiative in Africa, and serving as founder and president of the J.C. Flowers Foundation. Chris.
Thank you very much, Mark, for that introduction, and greetings to all of you. I'm grateful that you've taken the time to join us today. Before I introduce our panel, I would like to say a few words about why we are involved in the fight against malaria and what role faith has played in that. From its beginnings many years ago, the Ann and Chris Flowers Foundation has partnered with faith communities in Africa and whose long presence in remote regions facilitates effective program implementation. This is not new to us. This is who we have always been. We became involved in malaria in 2004 at the urging of Susan Lassen from Episcopal Relief and Development, and Susan went on to become the CEO of our foundation. We felt that while some problems don't have solutions, this one does. And indeed, although we are all called to this fight, regardless of the economics of it, malaria is one of the best deals around in terms of return on investment. And our principal partner from the beginning in this endeavor has been the Anglican Church in Africa. We could not do what we do without each other. Our foundation has chosen to work in the last mile communities in Angola, Namibia, Zambia, and Zimbabwe, communities that are often under-prioritized by others. In these areas, we have become convinced of the role of faith leaders who understand the local realities and speak with moral authority. During the time of COVID-19, faith leaders have continued to include malaria teaching in their weekly services and pastoral care. Because of the trust they have, these faith leaders and other community leaders have been able to convince parents to continue to seek malaria testing and treatment for their febrile children. Some had been afraid to go to the local health post out of fear of catching COVID-19. Community networks and local faith leaders are also powerful because of their intrinsic motivation. They care deeply about controlling and eliminating malaria because the health of their own families is at stake. Malaria elimination requires many, from entomologists to drug developers to supply chain managers to future funders, including the Global Fund and the President's Malaria Initiative. But their work has limited impact without community engagement. And faith leaders can be a powerful force for community engagement, as you'll hear now. Let me introduce our panel. Dr. Kundai Mapanga is the pediatric medical officer at the Rundu Intermediate Hospital in Namibia. In addition to her clinical work, Dr. Mapanga is the leader of the Regional Malaria Task Force team, which strengthens cross-border collaborations with regional health departments in Angola. The Right Reverend David Njovu is the Bishop of the Anglican Diocese of Zambia and member of the Zambia End Malaria Council. He's been involved in anti-malaria efforts since 2004 and has been nicknamed the Malaria Bishop. Sheikh Dr. Shaban Firi is also a member of the Zambia End Malaria Council and has been Secretary General of the Islamic Supreme Council of Zambia since 2010. He is a Muslim religious scholar who extrapolates Islamic principles and passes juristic opinion on various Sharia questions. Bishop David and Sheikh Shaban together lead Zambia's FLAME, Faith Leader Advocacy for Malaria Elimination Coalition, which is bringing faith leaders together to advocate for policies and resources that will eliminate malaria in Zambia. Dr. Jenny Dyer is the founder of the 2030 Collaborative, which supports faith leaders to advocate for global health and development. She also directs the faith-based coalition for the Global Fund to fight AIDS, tuberculosis, and malaria in partnership with Friends of the Global Fight. She is also a lecturer in global health politics and policy at Vanderbilt School of Medicine. And last but certainly not least, Neville Isdell is my fellow co-founder of the Isdell Flowers Malaria Initiative. He grew up in Zambia. He is a member of the SADC Board of Directors of the Malaria Elimination Aid Secretariat. And in addition to being a philanthropist, he is the former chairman and CEO of the Coca-Cola Company. With that, I turn it back over to you, Mark.
Thank you so much, Chris, for your opening words and for your work in this area. Well, let me begin with Dr. Kundai Mapanga. What are the realities of malaria in Namibia and in your region around? And how has COVID-19 threatened that response in the health system you work in?
Thank you very much for the question, and Mark, and thank you for having me on this panel. So first, I'd just like to say that where I'm situated is between the border of Angola and Namibia. So we do see a number of cross-border cases from Angola. And what it's done, unfortunately, there has been a lot of setback pertaining to malaria. Firstly, with funding, we have seen redirection of funds, which is why we are also grateful to Global Fund that has continued to support us as well as a cross-border initiative. And because of the overlapping symptoms of fever, what we have noticed is that before we used to screen a lot of patients with fever for malaria, but that all got redirected to COVID. So quite a number of cases of malaria have been missed during this time. And with decreased health-seeking behavior, unfortunately, our mortalities have gone up as well this year. With the lockdown, it's really restricted our healthcare, community healthcare workers who are also critical in going out into the communities. They haven't been able to do that this year due to lockdown and social distancing as well. Also, a lot of the programs had to be terminated because transport, which is very critical in this area because villages are very fast-spaced, has been shunted to COVID-19 responses. So a lot of the work that they would do in the vehicles were then removed. In addition to that, we've also seen the IRS, which is the indoor residual spraying, had to be stopped this year as well due to COVID and accommodating COVID-19. So we have lost a lot of ground, and unfortunately, it's also reflected in the mortality rates that have gone up.
Of the factors that you mentioned, which have been the most acute, people not being able to go into clinic and get take care of a child who may have a fever, or getting anti-malarial medicine, or the problem of distributing next generation bed nets, more area spraying.
Yeah, so I would say the drug interruptions, unfortunately, they really did affect us. We ran out of medication for quite an extended period of time. Unfortunately, what we found as well is when sick children came to the hospital, they did come rather late. Prior to the time, they would come in early after screening for a fever. So that also increased our mortality rate because by the time they came, it was cerebral malaria. Our resources and availability to treat them before we have to send them to the next referral hospital, which is 7 hours away, was also limited as well. So all those factors were aggravated because of COVID.
Dr. Mapanga, what have you seen as the important role of faith or those who are in the faith community in fighting malaria? How has it come into your practice, your policy work, your community work on malaria?
I think faith has provided the platform to treat and see people with the right lens, and that is appreciating the value in everybody and understanding that everybody has the right to healthcare because everybody is valuable with that lens. It's been really crucial where I work, which is a rural area, because a lot of the people respond well when they receive sort of instructions or advice from their faith leaders, and they're very open to receive information from their faith leaders. And what we've found is that when they hear it from all fronts, that being the medical front as well, from faith leaders as well, they are more willing to understand and also adhere and see the importance of completing their medication, using the mosquito nets, allowing community healthcare workers to go into the community to even spray their homes.
Wonderful. And how have you found that role of faith voices or faith-based implementers in communities as COVID-19 has become a complicating factor in malaria work? For instance, the guidance and teaching that can come for people to make decisions. Do I take my child into clinic if she has a fever, or do I stay remote? How have you found that important role of faith actors?
What I've seen on the ground is that the faith actors have really helped us with the community to help them understand actually the realities of COVID-19. So within the area that I work, I just want to point out that in the beginning, COVID-19 required you to have access to the internet or to be able to read, to understand, because it's quite a new virus that came onto the ground. So the ability to access people in remote villages was very difficult for us because they don't have cell phones, they don't have access to the internet. Many are illiterate as well. So the role of the faith leaders was really crucial because they were able to go out into those communities, they were able to share, disperse information, and then reiterate the importance of coming back early.
Thank you very much. And I want to tell those of you who are participants in this webinar, we'll have an opportunity for you to pose your questions to a panelist towards the end of our hour. You'd put them into the Q&A box, and you can think of questions now, but we'll be bringing in as many of you as we can manage later on. Now I turn to Bishop David Njovu. He is indeed a firebrand in drawing attention to malaria. I had the pleasure of meeting him 2 years ago when he came to the United States and was part of advocacy with regard to the President's Malaria Initiative and the Global Fund. What's been the impact of COVID-19 on malaria response in your experience in Zambia? You are on mute, if you'd like to unmute yourself.
Thanks very much for the question and greetings to all of you. As Dr. Kundai has mentioned, COVID has had a lot of impact on the fight against malaria, especially in the months of March, April, when we are on lockdown. But we took advantage for the WHO guidelines, which we were given, such as masking up, sanitizing, social distance, the use of PPE. Using that, we were able to go out now in the community doing two things. While sensitizing people about COVID, we were also sensitizing people and reminding them that malaria was still present. And with this new knowledge that the community health workers got, they were able now, around June, they were able to go back into the communities where they continued with the testing, the treating, and tracking of patients. And at this point, I want also to thank the Global Fund who made it possible to have the testing kits. And not only that, COVID also taught us now to use the platforms such as WhatsApp, Facebook, and YouTube in order to communicate to our members. And as we were communicating the messages in the places of worship, it also included the message of malaria, because we had to explain to the people why we had closed up the places of worship. And the answer was that because of COVID. But in the explaining of that, we also reminded them that malaria was still present, and it was even more dangerous than COVID was, in the sense that more people were dying during this period than those who died out of COVID here in Zambia. Your mic is muted.
Your turn to tell me that. How have faith leaders and community health workers worked together in this situation, and how have your interfaith partnerships, worked to grapple with this COVID complication?
I think we had some lessons prior to this. The HIV and AIDS helped us to come together as faith leaders and see how we could have helped people who were bedridden at that particular moment. And we took that knowledge and experience and brought it now to the issue of COVID and malaria. And as we came together as different faith leaders, we broadened up the launching pad to our members. And this helped us the unity. We were speaking now with one voice. It didn't matter which faith group you were coming from, whether it was Muslim, Baha'i, Christian, because the leaders had agreed to work together. And because of that, it was having, and it is having, impact. For instance, recently we're in one of the rural places in Zambia where these different faith leaders came together, training up other faith leaders in the community. And it gave a very good picture because all of us, different faiths, were there to talk about malaria and how we can eliminate malaria. And if we can be united as faith leaders, it means that even in the communities, it will be easy for the people to work together regardless of their faith. And that is having an impact. And not only that, it means that we are carrying an advocate's voice. When we approach the government officials, we are approaching them with one voice. And that is working very well for us.
Could you give an example when you talk to government authorities about what you're doing and you're urging them to put the resources and the time into things, how that works? How you did that?
As recent as 2-3 weeks ago, we were having a workshop, and the one who came to officiate was a permanent secretary. And during the lunch period, I was able to engage him and ask them to continue to support the work of malaria despite the fight against COVID. And we were able to give them the facts, which they know very well. Between January and July, 1,200 people have died of malaria in Zambia, while we're talking about 300 people who have died of COVID. And with this, I was able to tell the PAs to say, unless they themselves lead the way, they show everybody that they've got a political will to eliminate malaria, people will not take them serious. And he agreed with me that it is an important thing that as government officials, they lead the way and show commitment to the elimination of malaria.
That's a great point that faith leaders and private sector philanthropists are really important in malaria response and COVID-19 response, but they're really potent voices in maintaining political will. After all, implementing governments need to make sure they concentrate on those who are vulnerable to malaria. I'd like to turn to Bishop David's partner in Zambia, Sheikh Dr. Shaban Piri. Why do you as a faith leader, Sheikh Shaban, believe that malaria elimination is a calling for you? And why is it important to work as interfaith partners?
Thank you so much for the questions, and also thank you for having me on this panel. Actually, it is the realization from our teachings of the religion that we have. For example, Islam talks about helping one another in matters of common interest, right? And we realize that malaria is a problem that does not only affect one particular faith, does not affect any particular race, but indeed it affects everyone. So it is a problem that affects all mankind. Here in Africa, particularly, as we understand that malaria is the #1 killer disease, which has claimed several lives of our people. And to come together as religious people is one of the fundamental beliefs that we established since early 90s as a result of HIV and AIDS, and that we came together to form up an organization which we call it Zambia Interfaith Networking Group, ZINGO, to address the issues of HIV AIDS, to deal with issues of stigma and discrimination. And we worked from that point as a religious leader, irrespective of our faith, irrespective of our cultural backgrounds, but we came together to fight these common problems. So when the issue came regarding for example, COVID and malaria, we all came together and simply say, this is a common problem that we have, and that we must fight this problem together as a faith, irrespective of our beliefs. And it has worked very, very well in Zambia, and we continue to work in collaboration as a nation, and regardless of our differences of doctrines and so on. And that is what has actually helped us much to work together with the Anglican faith in the fight of against malaria. This is the aspect that we have always applauded and encouraged people, and it has encouraged so many people. Our followers have taken it upon themselves to see that we can work together. And you know, when God at times gives us these kind of diseases or pandemic, there is a wisdom behind it. And we discovered that one of the wisdom behind it is to bring the faith together. Sometimes we could not sit one-on-one or face-to-face and discuss matters as religious people because we have got a different faith. But God can bring malaria, can bring COVID, can bring HIV and AIDS, all these diseases in order to unify all of us and to draw a lesson from there that human beings indeed we can work together irrespective of our faith and so on. And this is what we have been experiencing in this country, that we have taken this matter seriously and we have worked as a team, irrespective of our faith, to fight malaria and also to educate our people about the COVID-19. And these are areas that we have been working on.
So, some of the people who are involved in this webinar have been involved in international philanthropy to fight malaria and other pandemic diseases. The Global Fund works on AIDS, tuberculosis, and malaria, but now has a COVID-19 resource mechanism that donor governments, businesses, foundations can give to. But in your interfaith work, how have you worked, for instance, in the End Malaria Council on domestic resource mobilization? Has it been a powerful voice to have both Christians, Anglicans, and Muslims in the clergy and among implementers speaking together to government officials to say, invest, prioritize the most vulnerable and the children?
Indeed. I think one of the key issues regarding the End Malaria Council is that it has been established also as a result of the declaration which the head of state, the President of the Republic of Zambia, Dr. Edgar Chagwalungu, who declared the year 2021 as the end in which we should be able to eradicate malaria. So there is that spirit of political will from the government. And the establishment of End Malaria Council can also be witnessed that it is the Minister of Health who is the chairperson of the body. And we have seen so many other, representatives from government departments being part and parcel of this particular institution to fight this problem. So we have seen a situation that the government has shown this kind of a political will, and it initiated this kind of an idea that we should come together. Now, regarding us, the the faith leaders who have been always on the ground to fight HIV and AIDS and so on. And we found this as a better platform for us to be able to engage these leaders and others to be able to fight this particular problem of malaria. So we have seen that kind of a collaboration, and the government showing that much interest in this particular fight, and the response in terms of domestic resource mobilizations. Our community, when we brought this news and when they're able to see that we sit with each other, we have the Christians, we have the Muslims on the body, and also we have representatives from the government working together on this particular problem, we managed to receive an overwhelming response from our members, and they came on board and they tried to support this particular problem. But unfortunately, of course, COVID came to disrupt the process. The attention of everyone had been focused towards eliminating and trying to find ways of preventing the spread of COVID-19. So most of the resources have been directed to COVID. But at the same time, this has drastically affected the prevention aspect of malaria, being the first or the number one killer disease, which has claimed several lives of our people. We found it very, very now difficult to be able to control this particular problem when the resources are going into COVID. Excellent. And we have seen that, the support has been going to COVID. Whilst people are dying in a large number, particularly in Africa, the majority of people are dying with malaria rather than with COVID. And you see, one of the symptoms is the fever, that we understand that even COVID has the symptom of fever. And this is the major problem that we have now encountered. Yeah. So because of that, we have been somehow disturbed because of that. But it is our earnest appeal that we need to handle this particular issue of preventing the spread of malaria. And malaria intervention is very much required, and we have to continue with the fight. And we hope the people out there will be able to listen and be able to put their hands together to continue supporting malaria. That's
great insight on urging government's political will, but also the actual lived experience of people with fever and problems of malaria caused. I want to turn now to Jenny Dyer. She founded 2030 Collaborative, named after the 2030 Sustainable Development Goals. She has long experience in the United States on public health and working in the faith community from the founding of PEPFAR, the President's Malaria Initiative, and the Global Fund. Jenny, we've heard quite powerfully from Bishop David and Sheikh Shaban about advocacy roles for faith leaders in Zambia. Do you want to speak a little bit more largely about the role of faith leaders, not just as implementing partners, but in advocacy?
Right, and thank you so much, Mark, for letting me play a role in this today, and thank you, everyone, for your incredible remarks. Just as a reminder, I don't think anybody said this yet, but it bears repeating, the global health investments worldwide cut in half the number of deaths caused by malaria. In 57 countries, the number of deaths have been cut by 75%. So, of course, with COVID, the advent of COVID-19, we just don't want to see a reversal of this incredible progress. And the faith community has been at the forefront of this progress, both as advocates, as both Bishop David and Sheikh Shaban have mentioned, and as service providers in the U.S. and around the world. Whereas rallying evangelicals in the 2000s to fight HIV and AIDS was a little more difficult because of the stigma and culture wars, malaria was far more palatable infectious disease to support. And in the U.S., during the Bush 43 administration, there really was an effort not only to support PEPFAR at the time, but then the President's Malaria Initiative. There was also kind of a 1-2 push to support not only bilateral but also the multilateral legislation of the Global Fund to fight AIDS, TB, and malaria. So all that to say, just for more than, for almost 20 years now, with education and awareness has only grown, wider and deeper among faith leaders and their communities across the U.S. and around the world for global health issues. Faith leaders really understand, I think, the role they play is imperative to advocate on behalf of those vulnerable populations worldwide who are fighting these infectious diseases. And they welcome the opportunity to encourage their congressional members to support these global health issues as moral issues. So that's kind of, I think, the point I want to make today. That is the unique voice of faith leaders that they bring to advocacy. They remind our elected leaders that this is not only, of course, the smart thing to do in terms of national security, economics, public health reasons, but this is the right thing to do to support, in this case, both funding for COVID-19 relief as well as to combat malaria. One great example I wanted to lift up over the last decade has been the United Methodist Church, both as service provider and in philanthropy. They've donated more than $23 million to the Global Fund for their Imagine No Malaria campaign for life-saving activities and distribution, insecticide-treated nets, indoor residual spraying, provision of anti-malarial treatment, and rapid diagnostic tools delivered to prevent and treat most at-risk populations across the African continent. So they proved to be one of the most significant non-government partners for the Global Fund. I also wanted to raise that this year alone in September 2020, we at the 2030 Collaborative, who direct the faith-based coalition for the Global Fund, had 193 signatories of leading faith leaders across the United States call for congressional support for funding for the Global Fund in the FY21 budget, but also for robust COVID-19 relief funding. Faith leaders, how can faith leaders play a role in advocacy? Faith leaders can contact their members of Congress, their elected officials, by email or phone or social media. Let them know that they care deeply about those suffering from malaria and COVID-19 and want to see leadership with support for the Global Fund and the President's Malaria Initiative. They can write an op-ed, learn more about these issues, and of course, I would welcome any of the faith leaders on this call to join us, write me, and we would welcome you to sign on to our letters with other leaders of faith to support this important legislation and funding.
Thank you, Jenny. I want to turn to Neville Isdell, and I'll bring you in, Dr. Dyer, again later in our dialogue. Last but by no means least, Neville Isdell, formerly CEO and chair of the Coca-Cola Company with its great global reach, and has since that time been an active leader in partnerships in malaria response. Why do you care about and invest in malaria response in Africa, Neville?
Well, first of all, I have had malaria. I was brought up in Zambia. In fact, I've had malaria twice. And I'm also centric in what I do in terms of wildlife as well, and I link that in at the same time. And I've always said that it's pretty scandalous that here is a disease that we know how to eliminate it, because it's been eliminated from around the world. We don't have to discover anything magical, although if we can find a vaccine, yes, that's great. But the means are there, and when you look at that and you travel around and you hear the stories of and you take the avoidance mechanism yourself, it just heightens the fact that society should be addressing this to a greater degree. Yes, we've had success. The numbers are there, but that just proves that it can be done. And I think today is a very good day to sort of think about what happens after COVID, because in the last week we've had great announcements about vaccines, and there's a post-COVID world coming, and we want to create, I think, that crisis of COVID. We want to capitalize on it, never waste a good crisis, okay? And to create some more movement behind malaria, because we have the means. but it's when the global community comes together, the funding comes together, because it is about funding, then we're able to do it. And I also think that COVID has helped people think outside of silos, all the connectivities that take place. Therefore, climate change links in with malaria as well. We work in a health silo, we work in a climate change silo, we work in protecting animal silos. But in fact, COVID says a zoonotic disease says we've got to think about everything that's connected.
That's across.
Absolutely across everything. And if we can link malaria more into that, and I think there are good examples of small examples even of that, then I think that's how we make progress yet again, despite the setback that we've had by being defunded because of COVID.
Neville, we've heard pretty vividly from other panelists here about the reach of faith leaders. One of the reasons one needs to turn to the faith community in Africa is because they, have an ability to speak to teach, to deliver services to people, including in remote places. Why in your work with Chris Flowers, have you found faith leaders and faith partners appropriate or valuable?
I think they're not just valuable, I think they're essential. Trust. And of course, we're in a world today of falsehoods being spread all over the place. So here you've got people who are trusted, leaders who are trusted, and also connectivity to people at ground level. Not just great global meetings and great commitments. They work on the ground. They work parishioner by parishioner. Okay. And then they have within that the multiplier effect of all of the people who are part of that particular faith, who want to do good with the world. So our troops out there that we have are people who've been trained, who've been initiated into it through the church, but then they volunteer their time to go out and actually work in the villages to teach people to make the behavioral changes that are needed in order to affect the elimination. And I think I talk about silos again. It creates a connectivity all the way through to the health professionals and to the medical professionals. But you're dealing with boots on the ground, committed people who are trusted by the community. And that, I think, is why the church has been so important and is so key.
Friends recently hosted a webinar on business innovation fighting pandemic disease, and the CEO of Vestergaard, which makes malaria bed nets, noted that you need to look at this, as a business person would say, the end user. And in many ways, the trust that is elicited by faith leaders can make sure that these marvelous innovations are actually used, or that the next generation of bed net that is not resistant to, it doesn't have resistant forms of malaria confounding it, are actually used. I'd like to try and move to our participants who have signed up for this and taking their questions. Please pop in a question into the Q&A box. I'll try and address a few of those. Where you say who you'd ask to respond. I'm going to try and address most questions to just one person, but there's a great question here from Delphine Thizi, who is interested to hear how faith leaders coordinate with national malaria control programs and with policy makers. We've talked about advocacy, but sort of coordination with national malaria control programs. Perhaps we might hear from Bishop David and Sheikh Shaban, and if she can rejoin Dr. Mapanga on that. David?
Thanks very much. here in Zambia, FLAM, which is Faith Leaders Advocacy Against Malaria, whatever we do, we are doing with the National Malaria Elimination Center. We are being guided by the strategic plan that has been put in. And they are our facilitators at most of our workshops. So in other words, anything that we have done, we are doing it together with the policy makers themselves. So there's nothing that we are doing from outside. And this has helped us also to keep them accountable to what they are supposed to be doing.
Dr. Bond?
Yes, indeed. As Bishop Njovu stated clearly, we are in this particular fight with everybody. And we are talking about those in decision making, trying to ensure that we deal with this particular problem. And what important thing is that our presence as faith leaders in this particular fight, it gives legitimacy to the work itself. And at the same time, because we are people that command confidence in our congregants and congregations, and the people trust their leaders. And when we speak, people listen, and indeed they take it seriously. So indeed, we do provide as a shining example to those in authority to be able to see that the religious people are working tirelessly to, to promote the messages of hope, to ensure that everyone adheres to those guidelines, everyone adheres to the framework or to the teachings that regarding malaria and regarding COVID and regarding other infectious diseases, that they should adhere to them. And when we speak as religious leaders, it carries much weight, and it encourages a lot of people to be on board and to be able to support the work. And the same applies to those in the decision making, that are able to comply, or rather to come in on board to be able to help the fight against the malaria. So indeed, that is the stance that we have taken in this particular fight.
Control programs, but also about this other question that's raised by Manuel Luberes. How can citizens, people of faith, medical specialists be sort of mobilized in surveillance, to be eyes and ears for the vector control on malaria? Do you see ways in which citizens, faith leaders, scientists can work together as eyes and ears of surveillance? And if you have anything you want to speak to in the other question, that'd be great.
Sorry, you were on mute earlier. Who is that addressed to?
Dr. Mapanga, do you want to address that question, and also ways that citizen scientists and people of faith can work in surveillance against malaria?
Yes, thank you so much for the question. I think what we've seen as well, even with our cross-border work, getting surveillance teams involved, is that when we, for example, see patients, sometimes we pick up on where a lot of the cases are coming from. The patients will also open up and say, prior to them getting malaria, perhaps they were in a particular location, just coming with taking a basic history from medicine, when we're taking a medical history. And when we're on platforms with surveillance officers, we've been able to actually share that information as well. And what that does also, in terms of the medical aspect of that, it also puts us on higher alert, so that we know when we have patients coming from specific areas. We also know to ask particular questions that would then relate to malaria as well. So I do think there are platforms, we've seen that it's very helpful and allows for more holistic medicine when we actually work together on those platforms.
So we had an interesting question or idea raised by Neville Isdell that, you know, the horror of COVID-19 provides an opportunity to focus the mind of the world on breaking silos and dealing with existing epidemics, new epidemics, health systems. What are there any lessons that are being learned from COVID-19 for advocacy, for building political will to end epidemics, to have more resilient health systems? Would any of you like to address that?
Yeah, let me just follow up on that. I think one example, and I'm taking it outside of health or malaria, but I also am very involved. I headed up the World Wildlife Fund in the US for 6 years. And the fact that COVID is really basically a zoonotic disease has then linked now this whole environmental push and climate change. And if you look at climate change, we talk about it being about people and the environment. It's about people, and it's people focused. And I think the opportunity now with President Biden coming in and talking about climate change, as we link that to people, we link that to the needs of people, we link that to the health, we link that to the survival, and then you get back into malaria. So if we can get into that loop, I think there's an opportunity in there. Whilst it's going to be climate change as the headline, if you think about it on a continuum, if you think about how it flows through, because you're doing it for people, then I think there's a linkage for us that helps us in our work in eliminating malaria.
Anybody else among our panelists wish to speak to that, or shall I take another question? Okay, I will. I know that the work of the Global Fund has been valuable in getting personal protective equipment and other things out to those who are community health workers, as COVID has complicated malaria, AIDS, and tuberculosis response. Do any of you have experience about how malaria volunteers are protecting themselves from COVID, how they are addressing malaria prevention or malaria treatment, whether in Namibia or Zambia, and that is a problem? Dr. Mapanga or Bishop David or Sheikh Shaban? Is that something I think we've lost for the moment, Dr. Mapanga? Bishop David.
One of the things that we did was to retrain the community health workers on how they can protect themselves from COVID. And then we provided the PPEs that they required so that they could do the job. So there was a retraining and the provision of the equipment that they required to do it.
Great. In the area of the sort of overall opportunity that the horror of COVID-19 offers for people to understand health systems, I wanted to ask Jenny Dyer, do you want to speak a little bit more about this advocacy role of the faith community in countries themselves that are grappling with the problem, and also in the donor countries? what do we see as an opportunity or a particular, complex problem for advocacy by the faith community with COVID?
Well, I'll be honest, I would defer to both Bishop David and Sheikh Shaban as being in country working with their faith leaders to speak to the advocacy, the powerful advocacy they are doing and have rallied. I wouldn't say that I'm the expert on that, but I think that the U.S. plays an important role for faith leaders to show their passion, support, leadership here in the U.S. to make sure that we are stepping up for this funding for COVID-19. But I would defer to Bishop David and Sheikh Shaban.
If I may, let me just ask Sheikh Shaban to say a word before I offer a couple of closing thoughts when we run out of time. But Sheikh Shaban, maybe you could add to Bishop David's insights. What opportunity do you see now with COVID for increased advocacy?
Well, this has actually helped us a lot to advance the way we've been doing our advocacy on malaria. Because of COVID, of which we managed to mobilize our people through, of course, after the lockdown was lifted, where we're able now to gather with our congregations, and also door-to-door kind of a campaign on how to to take care of themselves, how to to apply the guidelines which the government has provided for COVID-19. So we intensified this campaign. At the same time, we have been also carrying the message of malaria. So we feel that based on the COVID-19 scenario, we would be able to advance our advocacy using the two tie system that we have, as we are advocating for against COVID, how to take care of ourselves, masking and hand washing and social distancing. We carry on the same message of encouraging our members, our congregation, to go for testing and also to sleep under the treated net and also to seek quickly medical treatment. And these messages are ongoing, which actually have resulted from the COVID-19. So in other words, nothing in terms of advocacy has been disrupted.
A super rich conversation has led us to run out of time. Let me just offer a couple of closing thoughts. There are a couple of powerful themes that come out of this. Obviously, we've just been talking about the important role of the faith community in teaching communities to grapple with malaria and COVID, to build the political will of governments in the developing world in Africa, and really to potently convince donors to contribute, for instance, to mechanisms like the Global Fund as a multi-stakeholder partnership. But we really have a picture here that Neva Isdell and all of the other panelists have painted of an opportunity that COVID-19 unfortunately presents us with. To use a metaphor from a ship, we have to have all hands on deck. We need secular civil society, we need faith-based leaders, business, foundations, and public sector authorities. And all of them need to apply their particular gifts, as people of faith put it, and resources. We need the investment of philanthropists, of private sector companies, and still donor countries as well, alongside national governments. I really want to thank you all, Chris Flowers in particular for co-hosting this and your work, and as our panelists, Dr. Mapanga, Bishop David Njovu, Sheikh Dr. Shaban Piri, my dear friend, Dr. Jenny Dyer, and Neville Isdell. I hope we can stay in dialogue, and please continue to tune in to our webinars. We want to continue a discussion in the community of those who care about the most vulnerable facing health security needs. Goodbye.